What if stem cells could revolutionize type 1 diabetes treatment? What if there was a way to treat type 1 diabetes that didn't involve constant insulin injections? Did you know that groundbreaking research is exploring stem cell therapy as a potential cure for this chronic condition? Stem cells, particularly mesenchymal stem cells or MSCs, could hold the key to reducing insulin dependency and improving the lives of millions of people living with type 1 diabetes. In this video, we'll delve into how this innovative treatment is reshaping diabetes management and why it could be the future of healthcare. Understanding type 1 diabetes and the power of stem cells. Type 1 diabetes, often called juvenile diabetes, is an autoimmune disease where the immune system attacks insulin-producing beta cells in the pancreas. This leads to a lifetime dependency on insulin. But what if stem cells could change that? Stem cells, especially MSCs derived from umbilical cord tissue, have the potential to regenerate these lost beta cells. They not only reduce inflammation, but also modulate the immune system, offering a double-edged sword in the fight against diabetes. Did you know that the International Diabetes Federation predicts that nearly 700 million adults will have diabetes by 2045? With numbers like that, the need for alternative treatments like stem cell therapy becomes even more urgent. How effective is stem cell therapy for diabetes? The success rate of stem cell treatment for diabetes is around 70 to 80% in some studies, particularly in India. This therapy involves introducing stem cells into damaged tissue to stimulate self-healing. These cells can even transform into insulin-producing cells, offering hope for managing both type 1 and type 2 diabetes. But it's important to note that while these results are promising, stem cell therapy is still in its early stages, and more research is needed. If you're finding this information fascinating and want to stay updated on the latest breakthroughs in diabetes treatment, make sure to hit that like button and subscribe to the channel. Stem cells, the future of diabetes treatment. Stem cells are not just a promising treatment for type 1 diabetes. They're also being explored for type 2 diabetes. In type 2, the body still produces insulin, but the cells don't respond properly. Stem cell therapy could help by increasing the number of insulin-producing cells to combat insulin resistance. Did you know that MSCs have been shown to improve blood sugar control and reduce inflammatory markers in clinical trials? These results suggest that stem cell therapy could offer a long-term solution, potentially eliminating the need for daily insulin injections. Understanding type 2 diabetes in greater detail. Type 2 diabetes is not only the most common form of diabetes, but also one of the fastest-growing chronic diseases worldwide. This condition is characterized by persistently high blood sugar levels due to the body's inability to utilize insulin effectively. Insulin, a vital hormone produced by the pancreas, facilitates the absorption of glucose or sugar from the bloodstream into the cells, where it is used for energy. In type 2 diabetes, the problem arises either because the body does not produce enough insulin, or more commonly, because the cells develop insulin resistance. This means that even though insulin is present, the cells do not respond to it as they should, leading to an accumulation of glucose in the blood. Over time, this high blood sugar can cause serious health complications, including cardiovascular disease, kidney damage, nerve damage, and vision problems. Contributing factors and risk elements. Type 2 diabetes is closely associated with lifestyle factors such as obesity, poor diet, and lack of physical activity. These factors contribute to the development of insulin resistance and the eventual onset of the disease. Genetics also play a role. Individuals with a family history of diabetes are at a higher risk of developing type 2 diabetes. Other risk factors include age, particularly being over 45, ethnicity, with higher rates among African Americans, Hispanics, Native Americans, and Asians, and a history of gestational diabetes. Managing type 2 diabetes, the ongoing challenge. While there is currently no cure for type 2 diabetes, the condition can be managed through a combination of lifestyle changes and medical interventions. Diet and exercise are the cornerstones of diabetes management, as they help regulate blood sugar levels and improve the body's sensitivity to insulin. Medications, including oral drugs and insulin therapy, are often prescribed to help control blood sugar levels when lifestyle changes alone are not sufficient. The quest for a cure, B cells and beyond. The primary challenge in finding a cure for diabetes, including type 2 diabetes, lies in addressing the dysfunction of beta cells, or B cells. These cells, located in the pancreas, are responsible for producing insulin. In people with type 2 diabetes, B cells often become overworked and eventually lose their ability to produce sufficient insulin. This progressive loss of B cell function makes it difficult to reverse the condition. Historically, one of the most effective treatments for replenishing B cells was a B cell transplant. This procedure aimed to increase the number of healthy B cells in the patient, thereby restoring insulin production. However, B cell transplants come with significant challenges. For one, the number of B cells needed for a successful transplant typically requires multiple donors. Additionally, recipients must take immunosuppressive drugs to prevent their bodies from rejecting the transplanted cells, which can have serious side effects. Clinical trials and future prospects. Numerous clinical trials are underway to better understand how stem cells can be used to treat diabetes. Early results have been overwhelmingly positive, showing significant improvements in glucose control and overall quality of life. However, larger studies with more participants and longer follow-up periods are needed to fully assess the long-term benefits and risks. Why mesenchymal stem cells, MSCs? One of the key advantages of MSCs is their safety profile. Unlike other types of stem cells, MSCs carry a low risk of tumor formation and immune rejection, making them an attractive option for diabetes treatment. Their ability to home in on damaged tissue and regulate the immune system further enhances their therapeutic potential. Did you know that MSCs can release specific proteins that promote new blood vessel formation and regulate immune responses? This ability to reduce inflammation and prevent further damage to insulin-producing cells is crucial for the long-term success of this treatment. The potential of stem cells in treating type 2 diabetes. In recent years, researchers have turned to stem cells as a potential solution for replenishing beta cells without the drawbacks of traditional transplants. Stem cells have the unique ability to differentiate into various cell types, including beta cells. When introduced into a patient with diabetes, stem cells can migrate to damaged pancreatic tissue, differentiate into new beta cells, and help maintain healthy insulin levels. For type 2 diabetes, stem cell therapy could offer a way to supplement the body's existing beta cells and enhance insulin production. This approach could help overcome insulin resistance by maintaining a higher number of functional beta cells than the body would otherwise have. Moreover, lab-grown stem cells can be induced to become insulin-producing cells, offering a potentially unlimited supply of beta cells without relying on donors. The road ahead: future research and hope. Although stem cell therapy for type 2 diabetes is still in the experimental stages, the progress made so far is promising. Researchers are working to refine these techniques, with the hope that stem cells could one day offer a long-term solution for managing, and perhaps even curing, type 2 diabetes. Current clinical trials are focused on understanding the best ways to deliver stem cells, optimize their differentiation into beta cells, and ensure their long-term survival and function in the body. As these studies continue, the potential for stem cells to transform diabetes treatment becomes more apparent. While a cure may still be on the horizon, the advancements in stem cell research offer hope for millions of people living with type 2 diabetes. As science evolves, so does the possibility of a future where managing diabetes is easier and more effective than ever before. While the potential of stem cell therapy is immense, it's important to acknowledge the challenges. The limited sample size of current studies, the need for larger phase 3 trials, and the complexity of stem cell dosing and timing are all hurdles that need to be overcome. However, as research progresses, we're likely to see more refined treatments that could offer a practical solution for diabetes management. If you're as excited as we are about the future of stem cell therapy, don't forget to share this video with anyone who could benefit from this information. And if you haven't already, hit that subscribe button to stay informed on the latest developments in healthcare. Stem cell research is paving the way for a revolution in diabetes treatment. With the ability to reduce insulin dependency and potentially offer a cure, stem cells represent a promising avenue for those living with type 1 and type 2 diabetes. As researchers continue to explore this groundbreaking therapy, the future of diabetes management looks brighter than ever. And if you're interested in learning the different upcoming medicinal technologies to treat diabetes in the future, check out our playlist on diabetes. And all you need to know above. See you in the next video.